Welcome, everyone, to this week's webinar. My name is Loretta Maddox. I'm an Account Executive and Compliance Specialist with Healthcare Compliance Pros. I have with me today Chad Schiffman, our Director of Compliance, and I have Nicole Mark, our Marketing Manager, who will be moderating our questions and also helping us with a few poll questions that we've added to today's webinar. So we are going to continue this series on a response and recovery to COVID-19. So we talked last week about, for those of you who were on the webinar, about getting some feedback from those of you who are out in the field and you're dealing with this on a daily basis, and trying to get feedback on lessons learned, what's worked, what hasn't, what are the biggest challenges. And so we have put today's webinar together based on those conversations that we had. As we go forward, though, through today's presentation, just like every other presentation that we do, we really want to hear from you. So, like I said, we will have a couple of poll questions, but we do want you to be sending in your questions. If something pops in your mind as we're talking about something, use the question button on GoToWebinar, and Nicole will see those, and then we will answer those at the end of the presentation, or we will, if it's something that's very specific or very detailed, we can get you back a written response. So with all of that being said, I do want to start out today with just some COVID-19 phrases. I think we are at a period of time now where we are hearing new phrases and they mean things a little differently than maybe they have before. Some of them we might be a little tired of hearing. Some of them we've just incorporated into our daily conversation. But I thought I'd share a few of those with you guys. So the first one, new normal. I think many of us, I know I have heard from many people who have said, this is a term we're kind of tired of hearing, but I don't know that it's going away. I think this term may be around for a little while. Then we've got stay safe, which is very sweet and kind, but again, we are definitely hearing that a lot. How about stay 6 feet apart or social distancing? I think that, again, very common phrase that's in today's vocabulary. What day is it? Has anybody felt like that? Because it seems like all of the days run together, especially when you're not leaving home or you're now working in an environment that is also your home environment. So it is hard to tell the day of the week in these uncertain times. I think we've heard that one quite a bit. Or how about out of an abundance of caution or due to COVID-19? I think this is a phrase that gets used anytime there's a change to something. This is what we're alluding that change to. And this is a cute one. If you aren't stuck at home, you're safe at home. And I don't know about many of you, but I think those of us who might be stuck at home, I don't know that we're feeling so safe anymore, but that's another topic for another webinar. And then flatten the curve. We've definitely heard that one quite a bit. But I think the one that I think we're hearing the most now is when we reopen blank, when they reopen blank. Think about, when they reopen salons, how many of us are going to be so happy that that happens? Or when we reopen our practice, this is what's going to happen. So just wanted to kind of talk about that a little bit, because I know we are all adjusting to this, I hesitate to say, but this new normal. So just to briefly remind everybody, we do have the COVID-19 Toolkit available, lots of good information in this toolkit. And I'm going to let Chad talk a little bit about some of the things that we've added over the last few weeks.
Yeah, thank you. So we've added a few policies in there. Obviously, we keep updating our webinars and those types of things and get those forms in there and those types that we talk about. But we did have a request even today for a document or a release for employees about COVID-19 training. So by the end of the day, we'll be sure to get that added to there. So it's constantly evolving. If there's things that you feel are missing or, that you ever notice, please let us know, and we'll try to get that information there for you and things that you need. But yeah, so I think that the most recent one will be the one that we get in there as of today, and that will be the employee training and release and acknowledgement type form. So
Great. Thanks, Chad. So now we're going to just jump into today's webinar with what we learned from you, from those of you who did provide us with some feedback. So one of the questions we asked was, what has been vital to your organization during this experience? And what I found very fascinating by this is that the organizations we talked to had a common theme, and these were organizations that were not related, different specialties, different areas of the country, but these 4 items were prevalent in these conversations. Leadership was probably the number one thing, because when this happened, when things started happening, it's obviously lots of changes have to be made. But in these organizations that we talked to, they all commented that their leadership was strong in this, and that they put together the people that needed to be involved in this, so that the organization as a whole was benefiting from the core strength of the leaders that were saying, okay, this is what we're going to do, this is how we're going to tackle this problem. Side by side with that is communication. So not only were the leaders in the organization working to find some solutions to this change, this rapid change that was happening, but they were also doing a very good job of communicating those messages. And we're going to talk a little bit more about that in just a second. And then another thing that I was really glad to hear was that the actions of the workforce and from the top down matched the core values of the organization. And Chad's going to spend a little bit of time talking about the culture, and especially a culture of compliance. But I think it's important to remind everyone, if you don't have written down your core values and establish those within your practice, I know right now with everything going on, you're thinking, I don't have time to do that kind of thing. But if that is not a part of your organization, it really should be, because if the core values are a part of that organization and leadership is acting in relation to those core values, that's going to trickle down, and you're going to see an organization that runs really well. Lastly, one of the vital things during this experience was the quick adaptation to change, because as we all know, we have had to make changes on a daily basis to be able to function and survive in this situation. And so the organizations that we talked to said that this was really key for their organization to be successful in how they move forward. So one thing that I want to talk about with leadership, I talked a little bit about this last week as far as having a team and having the right people on the team. And so the organizations that we talked to said that they definitely had physician leaders on the team. They had administrators. If they were a large enough organizations where they had, their CEO or their CFO or their, clinical managers, they had these people on the team, because as we all know, a situation like this impacts all areas of the organization. They stated that they had regularly scheduled meetings, that this was very important because, things are changing on a daily basis. News is coming out on a daily basis. Regulations are changing. And so they quickly put together scheduled meetings that we're going to meet at this time, this day, either every day, weekly, however often that it needs to happen in order to keep everybody updated. And then they divided responsibilities. And I know this is sometimes difficult in smaller organizations because there may not be as many people that you can divide the responsibilities across. But when you do have that team leadership approach, then you can divide these responsibilities, because just think about the number of things that are coming out every day. And for one individual to be able to take it all in and then put it back out in a way that makes sense for the organization, that becomes a very daunting task. So dividing those responsibilities in a way that makes sense was important for these groups. And then they made decisions as a team. They said that they came together, and again, that kind of goes back to those scheduled meetings, and they would make these decisions based on that, sorry, I have got a leaf blower in the background, and this is the new world we live in where we're trying to do webinars and we have yard work going on. Sorry about that. That'll pass in a second. But anyway, the point is that leadership and teams were very, very important. And so at this point, I do want to try our first poll question. So you'll see the question on your screen, but I'm also going to launch it within the webinar. So I'm going to go ahead and do that. And we are collecting responses now. Can everybody see that on your, well, Nicole, can you see it?
Yes, I can. It's working.
Okay. Do you guys see the responses? Or is it just the question on the screen?
Just the question so far.
Just the question. Okay.
It says it's collecting responses right now for you.
Okay. All right.
I think go ahead and close the poll now. It looks like you've got a good amount.
All right. Good deal. Okay. Let me go back to my slideshow. Okay. Well, I apologize that you guys can't see the results, but I'll go ahead and tell you what they are. So, do you have a COVID-19 response team? 69% of the attendees on the call said that they do. Oh, there it is. Is it popped up on the screen now? All right, good job. I don't know how that happened, but however that happened, great. So 10% of you are in that situation where the team is you. And I've been in that situation before, not in COVID-19, but I know that is a hard role to play. But I know those of you who are in that position, there are other options for you. I know you don't have a team in-house, but that is a great time to reach out to HCP. It's a great time to look for other resources maybe outside of your organization. But just know, for those of you who are doing this by yourself, there are definitely resources. All right, so the next thing I want to talk about is communication. So I mentioned this was a key aspect of these organizations that we talked to and how they made it through these situations. And so regular communication within the organization, this was they definitely were doing weekly calls with leadership. They were doing daily updates, whether that was through emails or maybe company chats if they had that ability, but they were keeping people informed. And I think communication, not only within the organization is important, but also communication with patients. And there were a couple of neat things that we discovered when we were doing these interviews that had to do with what types of information was being communicated to patients. So screening procedures, this is new. We haven't been doing this in the past, where we are asking patients to not come in the front door, but to call us on their cell phone when they arrive at our clinic. And so those were things that these practices put those things into place and made sure that they had a script, that they were letting patients know how to contact them and what to do. Because that, as with all of us, the more information we have, the easier we may feel about these changes. And I think they saw that that was key, especially with their patients. How-to guides for telehealth visits. This was really neat. I had one orthopedic practice that said when they had not been doing a lot of telehealth, but when they started doing telehealth, they realized that their patients really didn't understand how to do it. And so they took staff members and actually made little short videos informing patients what they needed to be prepared for that telehealth visit. And I know it seems silly, but even to the point of how to dress appropriately for a telehealth visit, because I guess in a few of these visits, that was not the case. And so they thought, okay, we need to take this and we need to kind of help patients understand what is actually happening during these visits. But even with certain exams, if it was a knee exam, an ankle exam, whatever it was, they provided information to their patients so they knew what to do. And then, as I've already mentioned, just what to expect when you arrive at the clinic, letting those patients know that things would be different for them. So the last two things that I want to talk about are the core values and adapting to change. One practice in particular said, and this is why, I mean, it came up in other conversations, but one of their core values was taking ownership. And the individual that I talked to said that this was very prevalent in their staff. And this was a larger organization. So the fact that it was seen not only in leadership, but it was also seen in other employees, just as a good reminder that if your core values are there and they are throughout the organization, at times of change and difficulty, if you have developed your organization based on those core values, you're going to see those in action. And I just thought that that was very eye-opening, especially in this particular practice. Flexibility within the workforce. They had, across the board with different practices, they saw that there are individuals that maybe weren't able to do direct patient care, maybe they could shift and do something differently. And I think you guys have probably seen this, those of you on the call have probably seen this happen within your practice as well. And so they were able to take people that weren't very busy and maybe cross-train them to do something else. Maybe that someone, if they're not seeing patients at full capacity, then we're going to take maybe a nurse practitioner and have them screening employees at the front or in the parking lot, or just whatever it is. They saw that flexibility within the workforce, and then just doing what needs to be done when it needs to be done. And again, that kind of all goes back to those core values and how you operate as an organization. Now, the next question that we asked was, what has this situation forced you to do differently? And so these were the top things that came up with when we asked this question. So telehealth is a big one, and I think we've seen that throughout. Maybe practices were thinking about it, but this pushed them to doing it. Centralized services. So this was something in a few different practices that where maybe you were taking certain services that were done at several different locations, and now, okay, well, we don't need all those locations right now because we're not seeing all these patients, so let's centralize some of these services. New utilization of staff, I mentioned that earlier, is that sometimes in a couple of the situations that we talked to organizations, they said that this was a hesitation in the past for them, that they hadn't really wanted to use employees in different ways, but this forced them to do that, and they've actually thought that now this could work well even going forward. And then, like telehealth, we've got a lot more remote work, and seeing the different types of things within the practice that can be done in a remote location, this has been something that has definitely changed for the organizations that we talk to. So we're going to do since the last poll question actually worked, we're going to do another one. So this question is, what are you doing now that you were resistant to doing prior to COVID-19? So you guys should see this on your screen now. And if you'll go ahead and start answering. And thank you guys for your participation with this. I know we haven't done this in a little while, and so I'm happy to see all of you participating.
I am too. The responses are interesting, and what's interesting about it is a lot of the responses that you had on that previous one kind of echoed what we knew, so this one will be real telling.
So we've got the results up there now.
Yeah.
We've got, wow, 56% of you are doing all of these things. And there is a small percentage that have made no changes, and that, I mean, we get that too. But this is very interesting. So now that you've answered that question, I want you to answer one more, and then I won't make you do any more of these. But let's do our last question, which is, what will you continue doing after COVID-19? Same answers, but I'm curious to see if these are things that you will continue to do or if they were just short term during this particular situation.
You know, what's interesting about this question is even today in one of the calls I was having with one of our clients, this came up. They were interested in knowing how will telehealth continue to impact practices or, you know, work from home strategies. So it's going to be interesting to see what responses we get.
All right, and here are our results. So 48%, I mean, a good amount of you that said you were doing all of it already are going to continue to do it. Are you guys hearing that feedback?
Yes.
Okay. How is it better now?
Yes.
Okay. All right. Sorry about that. All right. Well, thank you guys for participating in those poll questions. Those are very, very interesting. And now I'm going to let Chad, if you want to talk about some of the challenges.
Yeah. So, you know, when we talk to practices and, you know, it hasn't really mattered what part of the country, but one of their biggest challenges that they seem to face is keeping up with all the constant changes. The one thing that we have learned about COVID-19 is that is a constant, is there's going to be change. And in fact, some change might even happen on the fly and happen the same day. In fact, one of our clients was at an appointment and, you know, accompanying someone and, you know, thought that maybe that, you know, as a visitor, they were told to come in and then asked it. On second thought, you know, why don't you wait out into the car and we will call you when you're available, because, you know, it was a good thing for them in this case, in that for the practice, because they are getting more patients in now. So now that they're getting more patients in, they needed the space available to make sure they had proper social distancing spacing in their waiting rooms. And so they advised for, you know, those who could wait to wait out in the car. So, you know, keeping up with the constant changes, that's a big one. And it's not just even from the government, but also, you know, within your organization, what types of things are being changed and how is that being communicated across the board. So obviously PPE, that continues to be a challenge. In fact, some of the practices we talk to say that's one of their main considerations for keeping things remote work from home and those types of things, because, you know, if other employees are in and may need to utilize that PPE, you know, do they really need it for, are they going to take from, you know, those who actually need it with their hands on things? So that was a good consideration. Also, that tied into the waiting areas, you know, how many patients are they going to allow and visitors and those types of things. So PPE, you know, getting it, pricing and all those types of things continues to be a challenge for organizations. Staffing and HR issues. We've talked a lot about this in our webinars, but, you know, determining who is going to work remote and who's going to work within the facility is a consideration that we're hearing more and more now that a lot of practices are getting back to those elective procedures and things that aren't just, you know, medically necessary. Next slide.
So now we're going to move on to the key takeaways, but my computer, there we go. There you go, Chad.
Yeah. So, you know, and then we can just go ahead and slide on to the next one. You know, some of the things that we've talked about today that have been working for organizations, telehealth. You know, as we've seen in some of the poll responses, we're going to continue to see telehealth being utilized. In fact, next week, our webinar that we're going to talk about is strictly on telehealth and remote work. We'd love to have some participation on that one. Even look at possibly even open up some mics and hear from some clients. So we'll see if we can figure that out, or if we're just going to ask for participation and questions and shared experiences and that kind of thing. Offering voluntary furloughs. We've heard that from numerous practices that actually help them, because a lot of employees, you know, they thought that was best for them and their safety, so it worked out well. The central location for patients with COVID diagnosis and symptoms, we've been seeing that. That's been working well for organizations. One practice in particular really talked about that. Remote work, next week's webinar, we will definitely focus on that, but remote work is something that's working and they're going to continue to utilize it. In fact, a lot of practices are finding that their employees have been more productive in roles that they might not have been as productive in being in the office. So they're going to continue to do that, even just for that consideration and those types of things. So I think it's really promising that some of these things are starting to look a little bit better than they did preliminarily when this COVID-19 first thing hit. So that's good. I mean, to see that some of these things will continue working. And really, at the end of the day, it's really about that culture of compliance. How are we able to follow? How are we able to keep up with all of these changes that are happening? As we've seen, compliance is kind of, in our minds, it's kind of at the center of everything, because you have compliance, and it's how are you aligning your communication strategies with your leadership and your core values, as Loretta's talked about. What processes are in place to ensure that you're complying with all these constant changing policies, if you will, or updates that come out from the government. All these things that we're required to comply with and change, keep up with on the fly are critical to an organization. And then as we move on too, and as we move through these, as things start to relax, we're still going to want to keep and maintain that culture of compliance. I think that's really important to know. Some updates that have recently come out. OSHA recently released our 10 steps workforces can do to stop the spread in the workplace. And as we've talked about in numerous webinars, and you've probably heard on numerous other webinars, or you've seen published in the media or whatnot, but it's those steps: staying home if you're sick, hand washing, proper cough etiquette, sneeze etiquette, those types of things. Flexible work sites, we've talked a little bit about that today, but that's something that we expect to see continue throughout the year and probably beyond, to be perfectly honest. And just all these types of steps, we will make sure to update these and put them in the form section as well, or sorry, in our toolkit. You'll have access to these top 10 ways to stop the spread. And then I think Loretta is going to talk about some HIPAA considerations.
Yes, I'm going to talk about just OCR has issued more guidance. I don't know if any of you on the webinar are making any type of disclosures to the media, but if you are, this is just a reminder from the OCR that you have to have patient authorization before any disclosure. And I think what's been happening, because I don't know, I mean, I'm sure you all have seen this. We've seen videos being taken from ERs, and we've got faces are blurred, but we're seeing these videos being shot in healthcare facilities. And what's happened is those videos, whether it's the media, or if it's an individual, those videos are being taken, and then after the fact, the faces are being blurred, or any PHI that's viewable is being blurred before it's posted. But the problem is any use or disclosure of protected health information must have an authorization if it's not permitted by the rule. And these types of disclosures are not permitted. And so this is just a reminder that we can't be doing these things without prior authorization from the patient. And I did put the quote, or a quote in here from Roger Severino, the OCR director, is that he's basically saying obscuring faces after the fact is not going to cut it. So we've got to have these authorizations in place. And although this may not apply to you guys, many of you may not be making media disclosures, keep in mind it's your staff. If your staff is doing this, if your providers are doing this, you have to stay on top of this, because if that stuff is being released, it doesn't matter if it's in the middle of COVID-19. This is not something that falls under enforcement discretion. So you really want to be careful, because the OCR is looking at this. I don't think it applies just to media. So just be very cautious.
Definitely, social media posting, all those types of things would probably tie into that as well. So be cognizant of all of that for sure.
Exactly. So just again, I'm putting this in today's webinar just because I know many of you have received funds. I just want to make sure that you know the deadline to attest to receipt of those funds is 30 days from the date that you received it. Many of you may have received it on April 10th. If so, you should have already attested. if you received it after that, we're at the 12th of May. So just make sure that you're going through these steps to a test. And just as another little reminder, there is a general distribution portal which can be accessed from this link as well, and this is specifically for healthcare providers who may not have a large portion of Medicare payments. So if that is you, then there is a possibility that you can apply for a distribution out of the general fund. And then there is also a distribution available for the uninsured program, which is if you've conducted testing or treatment for uninsureds based on COVID-19, you can use this portal to request reimbursement. So I just wanted to make sure that everybody's aware. And then moving forward, as Chad did a great job of talking about it earlier, next week's webinar is going to be compliance considerations for telehealth and remote workers. There is a lot to consider from a compliance standpoint in both of those regards. And as we can see from our poll question, many of you are doing this that may not have been doing it before and that you're planning to continue to do it. So we want to make sure you're compliant. And so we're going to do a brief webinar next week. We do still want to hear from you. If you have, just like today's webinar, if there are things that you guys are doing and that they're working, please share those. Let's use this opportunity to help each other. Or if there are things that you're really struggling with that we have not covered, let us know, because that's why we're here. We're here to help you. We're here to provide assistance, and we want to help you get through this situation. Chad, do you have anything else that you want to add?
Yeah, there's one thing that I wanted to talk about earlier, and I apologize, I didn't get it in, but we did receive a question that was asking about COVID-19 risk and informed consent. Is it applicable to medically necessary exams and follow-up are back up and running? She asked, is this part of the new normal? And our thought is that at least have some sort of form on, a signed form that says that they understand, that it is, as long as it's still in a pandemic status, as sort of a best practice to protect yourself. Now, some organizations are opting not to even deal with it, but we feel like it is a good idea to have a signed form, signed consent on file. In fact, we've added one to our toolkit. And, is it part of the quote unquote new normal that that we're hearing? And to a certain extent, I think as long as there's a pandemic, it should be, just to protect yourself, to say, hey, we've advised you, we are in a pandemic, there are some potential risks, because you just never know. You don't know who could be a squeaky wheel, and maybe they didn't even get, come into contact with COVID-19 in your practice, but they might think they did and say they did, and then, that could trigger investigations and those types of things, and we don't want that. So I just think it's a good idea. Is it new normal? Yeah, for the time being, I would say it's a best practice. I don't know that we want to call it the new normal, but, definitely consider using one for now. So I just wanted to add that in there.
Great. Well, we're at the point now for questions, and I think we might have some. Nicole, do we have some questions? Okay,
yeah.
Great.
So one of the first ones that came in at the beginning here, they asked if we have a sample letter to send to employees who are being asked to return to work. I understand that this is required as part of the PPP loan forgiveness, especially if they decide not to return.
Oh, okay. I don't think we have a sample letter, but that's certainly something that we can research and see if there are certain requirements for that. Chad, do you have any insight on that?
Yeah, I think that's what we'll do is we'll research and see if there's any requirements, and if so, we will get that added to our toolkit promptly. Nicole, if you have their email, we would definitely share it and let them share once it's added.
Sounds good. Okay, the other question here, I would love help with travel policies for staff. Are others allowing air travel and letting employees return to work immediately? I worry about liability in our and our state is a stay at home, safer at home order.
So with that one, I think you have to look at what is happening locally. If you are a safer at home state and you have employees that you're concerned about traveling, I think this is absolutely acceptable to have that policy. And what I'm seeing is it's basically, I mean, you're basically not saying you absolutely cannot travel, but what you are saying is if you travel, it's, I mean, we would recommend that you not travel. If you're going to travel, you're going to have to disclose it, and you're going to have to, I guess, self quarantine for a certain number of days after. Chad, are you seeing anything like that?
Yeah, I've heard comments like that, and then often, the way, I guess it's risk versus reward really, and what's the purpose of the travel? Is it for something that's really essential and critical, and they'll do some determinations like that is what I'm seeing. That's sort of driving the policies. But I think we could definitely draft some sample policies with both considerations though.
Right.
If it's safer at home, and just reminding you to check with your locality to see what's going on there, above and beyond. Here in Florida, for example, where I'm at, is we have a whole variety of different policies. We have our mayors saying one thing in one area, and then obviously we have our governor who's saying certain things, but different mayors in different counties, there's different counties that are required to wear masks wherever you go in the community, whereas ours is not, so it's just kind of interesting in each of those considerations. And I think the same is true with travel. Some counties are saying, hey, yeah, you can, if you have employees that are required to travel, they can, and then just follow the CDC recommendations for traveling, whereas others are safer at home orders are still in place, even in just the counties here. So it's kind of interesting to see how that kind of plays together.
And it also depends on the role of the employee too. I mean, if they're direct patient care, but even beyond that, I mean, if they're traveling and coming back to the office, then, is that a risk to your other employees as well? So we can definitely look into that and get some sample information available.
Great. That's the end of the questions.
Okay. Well, thank you all for attending today. We do appreciate your feedback and participation. Sorry about the leaf blower incident, but that's beyond my control. But we are looking forward to next week. We hope to talk to you guys then. Take care.
Thank you.